Hey everyone, my name is Dr. Jason Miller. I'm the co-founder and clinical director of PostureWorks. We have facilities both in San Francisco and in Denver. And I want to make a quick video today explaining what causes disc bulges, what causes disc herniations. Do you know? Are you suffering with a disc bulge? Or one of your family members have a disc herniation? Were you told that that's the source of your pain without being told what's causing the disc to bulge? Quite frequently, that's the case when we have patients that have come in here from failed surgeries or failed treatment at other chiropractic or physical therapy offices, and they'll know that they have a disc bulge, and I'll always ask, well, what was the reasoning you were told for why that disc was bulging? And if they've been given an answer, they've usually been told it's part of the aging process, and that is absolutely false. Right behind me, I've got some x-rays. Right, and this x-ray over here, this x-ray is of the lumbar spine that's got a normal curvature coming back this way, right? And when we have that curvature, the weight of our body is equally distributed amongst all of the different joints and discs of our spine, right? But in this x-ray right over here, you can see that this person's lumbar spine, which should be following this green line and curved back this way, is actually shifted backwards, and it's bent in the wrong direction right in throughout this area here, right where this big disc bulge is. Right? We've seen that on an MRI, but on the x-rays we can start to understand why is that disc bulging. Right? So I've got a spinal model here, and I want to show you that we should have three distinct opposing curvatures inside of our spine, almost like an S. And when we have that S, it acts as a spring, it acts as a shock absorber as we go locking along, making sure that all of the force of our body's motion as we go slamming into the earth and all that force is rebounded back up against our body is distributed equally amongst all the different joints, bones, and tissues of our spine, as well as those discs. Right? The discs sit in the front part of the spine right here. If we lose the normal curvature, maybe say because we always spend too much time seated, bent forward, looking towards our desks, you see how when we go from a curvature here, if you watch that disc right there, if it starts bending forward, can you see and understand why that would put more pressure onto that disc? And that's what's going to cause a disc to start to bulge. And if it's not addressed, eventually that disc is going to pop, and that's what a herniation is. It's never because of the aging process. This patient right here, at the top part of their lumbar spine, they have a normal height and size of a disc. Where down here, there's a disc that's lost over 50% of its normal disc height. That is not part of the aging process. Those two discs are the same age. Right? So remember, a treatment plan can only be as good as the diagnosis. So if you've been told, or a family member of yours has been told that there's a disc bulge is the problem and the source of the pain, the question needs to be, what's causing that disc to bulge and how do we stop it from bulging? Now, quite often, one of the treatments that is utilized for a disc bulge is what's called decompression, where they'll lay you down onto a table, hold onto the pelvis, hold onto the rib cage, and a machine pulls the two apart to try to decompress that disc. The problem with that is it feels great while you're in it because those two pieces being pulled apart do cause decompression, but then when you stand up, instead of having a normal spring, you have a pull cue. Right? And so it's temporary relief at best. And I've seen patient after patient after patient that have gone through multiple rounds of decompression, and then I look at their x-rays and it's perfectly straight, and now it's starting to cause problems in other areas as well. Right? So if you want to learn more, please reach out to us at either PostureWorks San Francisco or PostureWorks Denver. Happy to help you find a chiropractor, even if you're not in either of those two areas. I'm a teacher for chiropractic biophysics seminars, the most researched technique in all spinal corrective practices that are non-surgical. And I have colleagues that are literally all over the world. I can help you find somebody near wherever you or your family members are at. All right, so if you learned something, give me a couple of thumbs up, share this video with other people so that they can understand these things as well. And remember, the most important thing to take care of your health is to take action, right? So reach out to us and we'll do everything that we can to help you. Hope you're having a great day.